Hello and welcome, our dear viewers, into a new episode of your show, Timeless Journey. And as you know, our dear viewers, in every episode we take you on a journey without time, without limitation. And of course, the only limit that we have is actually, well, there's no limit. And I wanna say like sky's limit, but it sounds a little bit cliche. And knowing that here in our show, we take you on a remarkable path, on a different stories, on a different lines, different fields. One episode we're gonna talk about the types of art. One episode we talk about a certain type of medical talk. Well, today we're going to talk about something really important. When whether you believe it or not, it's actually include you as a person who's watching us. Everyone actually, let's say, included in this talk because it is really important. And today we're going to talk about the shoulder injuries. And I know either you'll be only sitting or standing or you practice some sports. Either ways, God forbid you would have it, but you will be at least interested to know more about it so you can at least avoid it. And with us today, our Dr. Albesharah, and he was going to tell us everything we need to know about, let's say, the shoulder injuries and knowing a little bit about him. So, Mr. Badr, hello and welcome, and thank you for being with us here in Timeless Journey.
Thanks for the invitation anyway. It's my pleasure to be with you today. I'm more than happy to talk to you about the most common problems of the shoulder.
It is one of the most common problems, which is the shoulder injuries, and a lot of people needs to focus at it. Yes, but for today, since we're talking like in a podcast show, and it is mostly a talk show, so we will try to make it as fun as possible.
Absolutely.
It is really important.
Yeah, hope so.
Yeah. So to talk about it, what are let's say, what are the most common shoulder injuries that happens, like, and the factors.
So when you say shoulder problems, you have to specify, is it within the region or outside the region? So let's focus most commonly in Kuwait or in the Western region. In Kuwait, the most common shoulder problem you see, you would classify them between injury and non-injury shoulder problems, or in other words, traumatic or non-traumatic. So if we talk about the traumatic, which is the most commonly seen in the young population due to sports, for example, and even trauma as well. So when you say trauma, could be sports or non-sports injuries as well. And later on, we can move on to the non-injury type of the shoulder problem. So in terms of the traumatic or sports injury, we would see them most commonly in the young population. When we say young, it's most commonly below 50. So I know this is surprisingly when you say 50 in Kuwait. So
that's a lot.
Exactly. 50 actually, it's in the middle age. So below 40 is young, 50 is middle age.
Yeah, actually, yes.
Exactly. Above 65, then we can say that's the elderly population.
Yeah.
So around below 50, let's say, those population, those people who practice sports. And when you say sports, there are different types of sports. Could be collision sports, such as, for example, rugby, hockey, soccer, football, even in
Shoulder
Kuwait.
injuries happens every day with these
Exactly.
type of sports.
Surprisingly, with most common types of sports, even with the swimming, young people, hyperlax young guy.
Even with swimming?
Yeah, exactly. If you have someone who's below, let's say, age 25, those population below age 25, nearly most of them, they have hyperlax joints, so hypermobile joints, so with extreme, let's say, range of motion of your joints. You can get a dislocation, whether in the shoulder or any different joint. So swimming, tennis, recently paddle, football in Kuwait. To less commonly in hockey, outside Kuwait you would say rugby as well. So we have, let's say, collision and non-collision type sports. In terms,
there is. I'm sorry to cut you off. There's actually many types. When we want to say factors of sports, there are many factors.
Absolutely, yeah.
Many causes. Like we can never end. Even sometimes, even when you just walk and hitting something with the shoulder, which called a trauma injury. But okay. No, there's actually something I want to go back a little bit, just back a little bit, if you may.
Yeah. Sure.
And I want to clarify something. We're not talking about only dislocation. We're talking about injuries at all, at mostly. What happens to the injury itself? Because I need to clarify this thing for our viewers so we can know. I mean, it's not just the pain in the shoulder. I
No.
mean, we're talking about like a limited range of motion, right?
Yes, good you mentioned that actually. So when you say different types of injuries, it's not only pain, it's not only dislocation. We have so many different types of injuries within the shoulder in terms of sports, I mean.
Sure.
So let's mention, for example, heavy lifting in Kuwait. It's very common between recently between females and males as well,
Everyone
equally.
does it.
Exactly. So some guy comes in with severe chest pain, huge, massive area of discoloration, bluish discoloration,
Mm-hmm.
big bruising. At this point, you would think of pec injury, for example, the pectoralis muscle, which is basically the chest muscle,
Yeah.
when you have it on right and left. You can get this muscle torn and because of, let's say, silly causes. If you're in gym, you're doing different poor techniques in terms of training,
Mm.
let's say flat or upper chest training,
Yeah.
poor techniques, wide grip, no rest between the sets, no rests between the days of your training, poor nutrition, let's say, excessive steroids, you might injure your pec as well. So this is one of the different types of injury, pec injury. Dislocation as well. If you have if you're practicing a contact sports, you might dislocate your shoulder. You might dislocate shoulder even if you're not practicing a sports. If you're going to grab something like from the back seat in your car, if you
Mm-hmm.
hit, as you said, if you hit a door, back door, if you just tripped over a carpet,
Exactly.
fell on the street, you might get a dislocated shoulder as well.
Yeah.
So this could be sports or non-sports. In general, yes, it's a trauma. Swimming, as we mentioned, hyperlax joint, you might
Yeah.
dislocate your shoulder. We see recently, now recently we've seen a traumatic rotator cuff tear or injuries. This is the most important
The
thing.
rotator cuff, which is the one that let's say give us the rotation
Exactly,
ability.
exactly. So basically, we have four rotator cuff muscles, one at the front, one at the top, two at the back. So
He's on the shoulder.
yes, exactly.
On
So
the shoulder, how many we have?
four rotator cuffs, four rotator cuffs.
In both shoulders.
Yes. So basically, those rotator cuffs attached to your shoulder blades. So as you know, we have two shoulder blades.
Yeah.
Each shoulder blade has 17 muscles attached to it. Four of them, they're called the rotator cuff, and they're
Yeah.
extremely important. So if we talk about the most common injured one, the one at the top, so basically that raises your arm up from the side, and we
Yes.
have, this is the most common injury, it's called supraspinatus, and we have a other one as well. It's called an infraspinatus, and one below it's called teres minor. Those two at the back, they're injury to a lesser extent, let's say. You'd be surprised with kind of patients who comes into the clinic with supraspinatus or rotator cuff tear due to injury and trauma.
Okay.
So let's say young guy below 50 or above 50, let's say, due to heavy lifting or tripping over the street or a carpet or over a wire or
Yeah. The second one, the second one happened like on the gods. Well, if you trip that you didn't mean to,
yeah.
but lifting something heavy and you know well that something is really heavy and you don't exercise much and you don't do a lot of things
Exactly.
that will prevent these types of injuries. Okay, so now we know that there is actually many types of injuries that happens, but what are the difference between for that happens for the shoulders injuries that happens for the athletes and the non-athletes? For the non-athletes, we might trip, we might lift something heavy.
Exactly.
So there is also non-athletes who might have, let's say, these types of injuries, because many of our viewers, oh, I'm living a sedentary lifestyle.
Yes,
I'm just
yes.
sitting. I don't do anything. Why would I get shoulder
Still they will
injury?
get shoulder. So since you mentioned in your introduction, your lovely introduction, that you might get shoulder problem,
You think my introduction was lovely?
absolutely,
Thank you so much.
absolutely. So if someone, let's say, living a very sedentary life, let's say a job of secretary that involves lots of fixed, most commonly, we've seen it in shoulder clinic. It's getting more common and common. Patients who sits in a chair doing a desk job
Yes.
in a static or fixed position, both elbows at the side of the chairs, involved sprinting, writing, reading. They might get shoulder problem. So basically, the shoulder problem has let's say, a spectrum of injuries from a less end, let's say lesser end or of the spectrum to more severe end of the spectrum. The lesser end or less extreme end of the spectrum would be rotator cuff tendinitis, which is inflammation. You hear it always in the clinics,
Yeah.
in TV shows, whatever.
I heard it a lot, and I met a
Rotator
lot
cuff
of doctors about it.
tendinitis. Tendinitis, basically, it's an inflammation. It's inflamed.
On the tendon.
Yes. When we say tendon, that's a good point. Let's mention it. Each muscle has an end. The end of each muscle is called tendon. So when we say tendon, that's the end of the muscle. So rotator cuff tendons gets inflamed due to lots of reasons, as we mentioned. So when you get inflammation of that tendon, without seeking any medical attention, with time, if you have a job that involves heavy lifting, overhead activities, or even a fixed position.
What are you mentioning? I'm sorry to cut you off. What you're mentioning is actually really important. I would the viewers, I'm urging you, please take a close listening and hearing about what our Dr. Better is mentioning right now. It is actually really important.
Absolutely.
Please continue, because for our viewers, that's actually raising the awareness way much, because everyone has shoulder problems without even saying.
Yes.
Everyone has it.
I always
without
see
noticing.
But we see it every day, actually, in clinic.
What happens when we avoid it? What happens if I cannot lift my right shoulder much? There is limitation in range of motion. I know, oh, that's probably okay. Maybe I slept wrong.
Yeah.
And it's happening for them like for maybe months and months.
Absolutely.
What happens when this happens?
Always seek medical attention from the experts. So we have shoulder experts, let's say shoulder specialists, we have foot and ankle specialists, we have knee specialists. So every joint in your body, there is a specialist, orthopedic specialist for it. So seek medical attention from the specialist so that you can get the best medical care you can get. Someone gets shoulder pain, as you said, sleeping. They say, like some of the patients say, I might got that shoulder problem because I slept in a wrong position last night, and then they just ignore it for weeks after weeks, months after months.
Exactly.
Initially, if you would look at it, it could be just inflammation. As I said, let's go back to the spectrum from
the less spectrum is
less extreme end of the spectrum to the more extreme end of the spectrum. The less extreme would be just inflammation, and the treatment of that inflammation is some sort of simple thing. Let's say
might be heat therapy.
Exactly.
Yes.
We always start with simple thing. I know we might talk about the treatment later on, but we can start like simple things. Physiotherapy,
and then we can cover the whole spectrum. Let's say,
that's the idea. However, if you just leave it and ignore it, let's say because of the lack of awareness, that would be the main reason, and then you leave it for weeks and months, and then that inflammation develops into a partial tear, and then that partial tear develops into a major tear, and then patient comes into the clinic. At that time, like repairing that tear would be quite difficult, because the older you get or the more you live, the difficult would be to repair that tear. Exactly. So that's why seek the medical attention as soon as possible. Don't say that just the shoulder pain will go away within weeks or some sort of simple painkillers. Just seek attention.
Seek attention. And a lot of people actually think, okay, even if it happens a tear, unfortunately, I mean, I got this question many times. I have another show, and we were talking with our physiotherapist, and we've been actually covering these most common topics, for actually a long while now. And why we do this? Because we still have these questions. We still have a lot of people comes to us, Abdul Latif, can you ask our doctor, why am I having these types of problem? And many people that we know, when you go to a Duaniyat, okay, how many people that you know? The last time I went to
all of them.
The last time I went to our Duaniyat, and there is like a guy, Abdul Latif, can you ask one of your doctors, like, there is certain problem happens to me, there is a limitation range of motion of my shoulder. I said, well, you don't exercise, you don't do a lot of things, and we're gonna cover how to prevent it later on. But unfortunately, there is the lack of awareness, and what's most reason about it, it's that how lazy we are to go to the clinic.
Yes.
Go ask. I know you're lazy. I know you have work. Just 30 minutes, go to the doctor.
Lazy to go to clinic, lazy to go to exercise as well.
Doctor, there is actually something, as a doctor, you are at let's say the other side.
Yeah.
I am on the right, on like, let's say the other side. I am with them. I see what they're seeing.
Yeah.
You know what do they say? What do they see? We actually see that if I don't want to go there, like I'm going to spend like hours and hours waiting in line. And then when I come to the doctor and he say, oh, just some heat. Oh, just like he will give me like write something down on
Yeah,
paper
yeah,
like
yeah,
a
yeah, yeah,
medicine.
yeah, yeah.
It's not like that.
Absolutely, it's not.
Our review is not
It's
like that.
actually exactly the opposite.
We're gonna talk about it also. It is really important what happens inside the clinics.
Yes.
How do the procedures do? Okay, now for the most important questions.
Yeah.
Okay, how can we, let's say, prevent it? And then after it happens, we're gonna cover the, let's say, steps.
Okay, so before we talk about prevention, just a quick clarification about the shoulder pain. You know that shoulder pain is really common, that it is ranked secondly the most to back pain as the most common reason for why some people might lose their job due to musculoskeletal problem or pain. So most commonly, as everyone knows, is lower back pain. Second most common pain would be shoulder pain.
Mm-hmm.
It is really common. It's really common than anyone thinks. Like, it's really common. I I thought that shoulder problem is common, let's say, outside the region. However, in Kuwait,
It's
I cannot describe how common it is.
yeah.
So many different types of problems between injury, non-injury, traumatic, non-traumatic, between both genders, males and females. So let's move on now to the prevention or preventive ways,
Which is really important.
as you asked. So prevention, we can divide it between those population who practice sports and those who not. So who do not. So those who practice sports or the athletic population, it's crucial to know your sport and to know how to avoid the injury inside your sport.
Where there is risks actually inside every type of
Absolutely.
sports.
So it depends in what position you play, in what level. Are you professional athletic? Are you recreational? Do you practice it inside the country, outside the country? Is it contact now?
All of these factors actually can be a
Absolutely.
risk.
Is it contact, not contact? You have to be in contact with your trainer, with your doctor. So, for example, if you sustain an injury and you're still inside the season, mid-season, let's say, if you require a surgery, you're going to be off the season. So this is a decision should be like that must be taken actually
Yeah.
between the doctor, yourself, and your trainer. So how to prevent those injuries? First of all, training. You should know how to train yourself. Inside the training, as I mentioned, most of the different types of sports, they practice, let's say, some sort of weightlifting. Weightlifting is crucial for the muscles and joints and
Really
and
important.
bones.
Yeah.
So and you might get really serious injuries with lifting. So you should know how to take rest between the sets. Take enough rest between the sets inside the training or within the training.
Yeah.
Take enough rest between rest days between the training days actually. So it's not acceptable that you train every day without, like, for example, taking 2 days off, let's say the weekends. It doesn't make any sense actually. Some, or let's say, I don't want to say all the people, like most of the people, they don't know that actually the recovery days, which is the rest days,
Yeah.
are the most important days for your muscle to get bigger.
Even
So,
more important than the exercising itself.
exactly,
Because
exactly.
if you don't rest, you won't get any progress.
Exactly, the progression, actually you see your progress inside the recovery days, and that's why they focus on the best nutrition they can get within the recovery days. You move on to the next point about nutrition. Focus on nutrition, focus on your supplements. Try to avoid as much as possible steroids, because steroids has like a huge impact.
Thank you for
Oh yeah,
yeah.
that's a crucial point we have to talk about, honestly.
Unfortunately, it's becoming as common as
With
buying your
100%
own
honesty.
protein.
Absolutely. Whey protein, creatine.
Buying your protein, it's as common as taking steroids.
Exactly,
Unfortunately.
exactly.
It's not the
Taking your
same.
protein, your supplements, creatinine, but
Everything.
amino acids. We cannot debate those actually, because it's proven in the literature that it benefits, those supplements benefit your body during the training. That's 100%.
And there's also dietitians that can help them to guide them on that. Yeah.
Exactly, including your meals. Nearly everyone now, most of the athletics, they know how to divide their meals, their calories, and how to calculate the calorie deficits. But I'm talking about the steroids. That I seen it nearly every other clinic. The steroids, I see it near every clinic. So I get patients with torn pecs, torn biceps. The biceps, we have two tendons. So one tendon at the elbow,
Yeah.
and the other tendon at the level of the shoulder.
Yes.
So I see lots of patients with torn biceps tendon. I see patients with torn Achilles tendon. So you hear me
I mean,
mentioning
the Achilles,
tendons.
it's one of the strongest
Exactly.
tendon in the body. It's the strongest tendon.
Exactly. Have you heard me when I say tendon, tendon, tendon? So this raises a question. Why
Yeah,
tendons? Because the steroids has a, let's say, catabolic or destroys
yeah,
the tendon itself. At the same time, it gets the muscle bigger and bigger. So you have a big,
exactly.
huge muscle with a very weak tendon. So how do you think this is gonna work with you? So that's why most of the patient I had one patient who came in to our clinic. He said, Doc, I had my Achilles tendon torn a couple of years ago. It was fixed, and my biceps as well torn like a couple of years ago as well and fixed. And I'm today here for my pec. And I asked him how many steroid courses you've taken over the past few
They
years.
cannot lie to you. They cannot say, I take none.
It is proven 100% that it has a bad effect on your body. Even those, most of them, they will say like, well, okay, most of the guys say, I'm totally okay this year. It's been like 2 and 3 years, 4 years since I had my course. I'm totally fine. I will be fine. I tell them within years, you will face some sort of problems with your tendon.
God forbid, but you will find,
Absolutely.
for those who didn't take it, try to stay away from it,
Please,
as
please,
important
please,
as it
please,
is.
please.
It is actually really important. And thank you for mentioning
Yeah,
that.
yeah.
We have a lack of awareness, and they only think that there is a certain factors or risk factors, and they take, if they take couple of protections, or like a couple, let's say, something to increase the immune system on that, and
Yeah,
they'll be
yeah.
fine. Well, even the muscles itself won't take it. Your body, even the guts inside, won't actually be handling it. And try to make it as natural, as normal as possible, which is really important. So, doctor, or should I call you doc, like the like
Just call me better, please,
better?
please.
Okay, so better. Okay, because you mentioned that your clients call you like doc. I thought it's cool. Okay, your
Yeah, yeah,
clients call
yeah,
me
yeah,
doc. I have this problem. Okay, it is really important to cover the shoulder
yeah, yeah.
problems. Uh, for many people, they think that practicing a type of sport is actually moving, so the shoulder muscle will be moving. It will be, let's say, getting bigger,
Yeah,
getting
yeah,
more
yeah,
immune
yeah.
into the shoulder dislocation or shoulder inflammation. It's not. There is actually something they need to take care of. Even for those who plays tennis, they get the tennis elbows.
Yes,
Golfers, they have the golf elbows, which is the injuries on the
that's
left
a good
side.
knowledge. Yeah, yeah.
I have actually years and years with many
That's
doctors
very
about
promising.
that. And for the shoulders, it happens to all of them.
Yeah.
Even if you play football,
Yes.
even if you play American football, American football, they will get it like
That's the
a daily
as we
basics.
said that's a collision sports. That's basically simply to
Exactly.
rugby, for
I
example.
mean,
Yeah,
this sport, like rugby. I mean,
yeah,
this
yeah.
sport requires you to go and pushing and lifting other people and throw them away
Exactly,
like
exactly,
the
exactly,
Hulk.
exactly.
So how can these people, let's say, what should, like, is there any types of supplement with a certain practice, because they don't work out the shoulder
Yeah,
muscles, they don't work out the shoulder muscles.
yeah.
How can they, let's say, stay away? And after that, we can cover for those who are, let's say, were non-athletes, how
Okay,
to
okay,
prevent it. How
okay.
can they prevent the shoulder muscles injuries?
Um, you mentioned supplements, so it's yes, it is 100%. I
Like
totally
glycogen, maybe, or omega-3.
totally agree with you
Yeah.
regarding the supplements. Most of them has to be on supplements, whether it's a whey
Oh,
protein,
our
whether
food
it's a
doesn't cover it. I mean, we mostly
exactly,
eat machbous. I don't think machbous or the
exactly.
rice or
But
the
no,
chicken
no, no,
cover
no. Please
that.
don't mention the matchboost. This
Yeah.
is my territory now. When you say the matchboost, I'm a big fan of matchboost.
Ah,
So yeah, yeah,
okay.
yeah, yeah.
Inshallah, after we
So
finish.
so let's in terms of now you said matchboost, I forget all the supplements. So
Okay. It's
anyway, but
the prevention. Yeah.
in terms of the supplements, everyone has to be on some sort of supplements, but this does not preclude your fully components meals. So you
Yeah.
have to be on a good amount of let's say a meal that has all the components you need, a good amount of calorie, depends on your body and your calorie deficits and your weight, stuff like that. And in terms of supplements, yes, you have to be on, let's say, simple stuff as whey protein, creatinine, branched amino acids, and however, staying on only supplements with poor nutrition as meals, this would be enough. This wouldn't be enough definitely for you,
Exactly.
and everyone agrees on fortunately in Kuwait, everyone agrees from the, like between all the athletics and non-athletics, the young guys, everyone agrees on that. That's why recently you see a lot of diet companies, a lot of dietitian raising awareness about that point. Even the athletics themselves, they know it very well. In terms of preventing the injuries, aside of the, let's say, aside of nutrition, preventing the injuries in terms of your practice, in terms of your training, in terms of
Mm-hmm.
your practicing the sport itself, try to, we say it in a way, try to injure yourself in a good way. So if you're going to fall, for example, playing a soccer, playing football, you know, if you threw yourself this
Mm-hmm.
way, in a specific way, you will injure yourself to a lesser extent.
Yeah.
It's very common between the athletics, you know it.
Sure. Yeah.
And when you train yourself, try to educate yourself about your training techniques. Try to avoid listening the training techniques from different trainer. I respect everyone with all the respect, but try to, for example, go through the training techniques. Now everyone has a mobile phone. YouTube is very helpful. You can reach any exercise in a minute or seconds. So try to
Not all of it are been set by qualified trainers.
yeah, exactly,
And, and,
exactly.
and,
That's the
and
point.
our physiques actually becomes different.
Yeah,
Yeah. But
yeah,
thank you for mentioning that.
yeah.
It is really important. Yeah.
Again, with all the respect, even if some trainers like show you some techniques of training, try to go look around those techniques. Try to search for those techniques. Is it right? Is it wrong? What can I do to to improve those techniques? Because again, believe it or not, techniques, your technique inside the gym might injure yourself, might get you a shoulder injury, for example. Again, as I mentioned, try to rest yourself. Take a good recovery days. Try to focus on stretching. It's not, it's you wouldn't believe it how commonly is for our Kuwaiti humble guys who leave their just leave their car in the park and then go inside the gym immediately within seconds from the car to the gym all the way to the bench. You have to stretch. You have to do some sort of at least
Thank you for mentioning that. Yeah.
2 to 3 minutes of cardio, just
They don't
to
do that.
raise your heart rate, to get you in the mood.
We have no time. They say, I don't have no
No,
time.
no, no. Everyone has a time. Everyone, and try to stretch yourself. Like it's unacceptable for your muscle to be trained immediately without stretching. Stretching is really important in order to avoid those injuries.
It is actually really important to cover these topics,
Yeah,
to try as possible as we can, let's say, not only to raise the awareness, because
yeah, yeah.
stretching help to prevent many types of injuries. For your viewers,
Yes.
you can search for now for today. We were talking about mostly the common injuries for the shoulder, for the
Yeah,
bones. Muscles are really connected to it with the tendons, but you can search about it and you can have, let's say, for the viewers, like they can have actually more information in regard to it, which is actually really
yeah.
important. This is the first part of our, let's say, interview with you, Dr. Badr Albesharah. And of course, we have the second part, but we need to go and then I'll be back. So for your viewers, furthermore on the second part, so stay tuned.